Hello, we're excited to be with you today, and thanks for joining. For the webinar, we're going to talk about taking cost out of healthcare and purchase services. And today we're going to talk to you about a case study and specifically around what we do in food. My name's Tom Swapp. I'm Vice President of Market Development for DSSI. I've been here with the company for a couple of years, but I'm not new to purchase services. I've been doing this for a number of years. I've been in the healthcare spectrum in a variety of different roles. I've worked for large industry GPOs, as well as for health systems, trying to manage the complexities of purchase services. I'm going to be joined by Meagan Pollak-Harrison, our senior spend management consultant and registered dietitian, our in-house foodie. Welcome, Meagan.
Hi, Tom.
You want to give us a quick intro?
Sure. I have actually been with DSSI for 15 years. So I came on to the team and was really focused on product management. So some of the tools that we're going to be talking about today, I've had a hand in developing and working really closely with our various supply chain partners, such as the GPOs and broadline distributors. I became so passionate about the food space and ended up working with a lot of dietitians that I decided I really wanted the full spectrum of knowledge, and have been a registered dietitian for a little over 4 years as well now. And that has really helped me transition into the senior spend management role, where my focus is really working with healthcare companies to optimize their supply chain and spend management to support their dining and nutrition service programs.
That's awesome. We're lucky to have you with us. Lucky to have you with the company. As I mentioned, DSSI has been doing this for a number of years. We've been doing this for about 25 years now. And we're very lucky to be surrounded by subject matter experts like Meagan that really make this hum. What we're going to be talking about today is a couple of things. As I've been doing this for a number of years, the one thing that's really plagued me as we've been doing this is, how do you get to the detail of spend? How do you figure out the complexities of all of these things in a single category and bring them together to create a simple, easy environment for the end user, one that can take cost out and also provide the quality needed for those that are providing these services. In food specifically, this is a very complex ecosystem. You have your various ERPs and accounting systems. You have your broadline distributors. You have specialty food providers, and that provide dairy and vegetables and produce. You have GPOs, and that are managing the pricing and writing the contracts. And then you have menu systems that tie all of that together at the hospital to be able to make sure that certain people have certain diets and that all of the needs are being met by the patients. Well, those are all very complex systems that have very specialized needs. How do you bring all of them together in one specific ecosystem? That's one thing that we've set out to try and solve with DSSI. We believe in spend management in the support services space, specifically in food, as we're going to talk to you today. There's a number of different steps, and the way that we view the world is really in analyzing it, implementing it, optimizing it, monitoring it, and managing it. What I say in analyzing is, to be able to analyze something, you have to be able to see all of the detail that's coming across. A lot of times in these categories that we're going to be talking to you about across these webinars, that's very hard to do. Those are coming in the form of paper invoices or receipts that are being left behind on the docks. How do you get that into an electronic format? Once you have that, you have to implement a system to be able to ensure that there's compliance, right? You have to optimize it. You have to set some controls on where your money's being spent. And then you have to monitor it. This is a very iterative cycle. We believe that as you continue to monitor it and manage it, and then implement it and optimize it, that you'll continue to reap benefits and savings. And the biggest part of this is, I think everybody at this in this time is really concerned about getting savings. And everybody is always talking about, you hear it from the CFO, you hear it from your management. How are we going to save money? The difficult part about that is, how do you save money while keeping the quality? And Meagan's going to talk to us about that today. So we're going to talk about a specific case study and bring Meagan back up in how this happens in actuality. It's very easy to put these up on slides and talk about it. But we're excited to have Meagan with us. Meagan and I worked together on a project with a health system in the western part of the U.S. and really doing exactly what I've been talking about, trying to optimize and identify savings as well as maintain the quality. And Meagan, being a foodie, is one to make sure that we do not substitute quality for cost. So Meagan, can you walk us through a little bit about this case study?
Sure. So as Tom mentioned, it was a 17 hospital not-for-profit health system that we worked with. They had a mix of both self-operated sites as well as sites using a management company. And really in that analyze phase that Tom was talking about, when I start working with a new client, I like to get an understanding of where they're operating at. So at the time, they were purchasing from 3 different broadline distributors, a variety of produce companies, a variety of dairies. They were spread throughout a few different states. So they had about 6 different distribution center warehouses they had to work with. And then they were all actually operating on different menus. So everyone under the management company was under one or a slight variation. And then the other was really around running their own individual menu by hospital, which gets tricky from a consistency and a brand and a quality and a nutritional standpoint. And so that was an area that we decided we really wanted to focus on first. Let's get the whole system on the same menu and really standardize the procurement and purchasing around that. We really looked at it, as Tom mentioned, from a nutritional standpoint, from a quality standpoint, and then also how are we able to bring savings forward with that. So what we were able to do was really look at different areas of opportunity. So with the patient menu alone, we were able to move from 500 different products in that standardization process down to 115 products that they really needed to use to produce those patient menus. With that alone, we are able to bring forward close to about $260,000 in savings. And then also just the savings time in managing the ingredients and allergens and nutritional information in your menu system to really ensure that the patients in your hospitals are getting the best products. And so just the maintenance on that side alone was really helpful, and get accurate costing and consistent costing. We also took a look and were able to find quite a bit of savings in consolidating produce vendors. And really with that, in addition to the savings, sourcing locally, trying to get local items from farms, but using a standard national program. So that was great. In this process, we also identified just some additional savings that they could work with. At the time that we wrapped up this case study, we hadn't had them fully implemented, but I'll talk a little bit more later on where we continue to carry over the process in other areas outside of the menus. So with that, let's talk about some of the results of the case study before I get into some of the details and see where they were at with compliance. One of the things that DSSI really helps support is as we're driving towards those change, we also provide a great deal of visibility and controls to help lock that in place. So a big part of what I help an organization do as well is really that change management process. We know change is hard. There's a lot going in for these folks in the kitchens and their day-to-day. It is especially trying. As I mentioned, I've been in this industry 15 years, and I would say the last year and a half has definitely been the hardest with some of the supply chain challenges we've seen with COVID. So when we first rolled this out, we weren't locking in the changes, but we were educating the system why we were changing to different products, why we were standardizing to the menus, and we were helping them with the process as they were coming on the new menus. What are the products they should be using, and what is that savings, and what does that mean to them as a system? So after we worked for about 5 months, we were able to get the standardization up to about 74% compliance. There was a little work to do there to get it higher, and that's some techniques we'll talk about here in a little bit where we started to block products. But overall, just on those patient menu items, we were able to save them 11% in savings and keep the nutritional value. I worked with the team on the menus, evaluating the allergens, the nutritionals for the ingredients that we're using, and then really evaluating their full contract program. So what are the best broadliners that we should be using based on their GPO contracts? What are the additional incentives and rebates to really maximize the program for the group that I was working with?
That's awesome. So I want to focus on a couple of things we kind of talked through this specific to this customer. there's a couple of different personas that we really want to look at. And from the lens of the corporate controls, obviously, the end user is a big piece, and we're going to focus on that in a minute. But from an end user standpoint, Meagan, there's a lot of benefits as you kind of go through this process and being able to identify savings and put the controls around it. Let's talk about that here for a second. And I'm just going to ask you a couple things here. So if you're at the corporate, and I mentioned kind of like there's always a CFO that is kind of looming and saying, hey, we got to cut costs, or there's somebody in supply chain or somebody who's putting pressure on somebody in nutrition to be able to save money. And so what does that look like for them at the corporate level of some of the controls that they can put around it to be able to actually enable the savings?
So a few different things here that really help benefit the corporate standpoint. The first thing is training. Turnover is huge. It's always an issue, making sure that they're using the right vendors, that they're using the right products. And one of the things that we can do at DSSI is, I like to say we're vendor neutral. So in this instance, where the system was using multiple broadliners, through some of the initial analysis we did, we got them down to 2. We wanted to have a primary and a backup just with some of the supply chain challenges. But the nice thing is, instead of your food service directors having to go out to multiple platforms, you may be needing to understand how they operate. They could access either of those broadliners with a consistent ordering experience. And so with that, also helps speed up the process of what we can do from a reporting and analytics standpoint, and touching on the timeliness of how you can process invoices. So what we do for you on DSSI is we'll actually automatically GL code those invoices for those vendors coming through DSSI that we process the invoicing for. You're making sure that those are going to the appropriate cost center without the user needing to do that on their own. If for some reason you have to change something because it's being used for catering or something in the cafeteria, we can override and edit those GL codes, but it's a lot easier to do that at the time of purchasing because the food service director really knows what's going on. It also helps with the timeliness of processing those invoices. So you may have prompt payment incentives with your vendor that you're able to hit much easier. I don't know about you, but I know every single hospital or food service operation I've been in, there is always a stack of invoices in a drawer. And, I find I was working with a different client and they're like, why did we have 3 months of bakery or dairy hit this month? And they're like, oh, we didn't know we needed to send those invoices anywhere. And so they sat on them. So now you probably only know this because your accounting team is getting a call from somebody saying, we're not going to deliver to this location anymore. You guys haven't paid us. And they're like, we don't have any invoices in the system even for you. So it really helps automate and bring that full visibility to the spend that's going on and make sure that your vendors get paid timely. So your locations are serviced and you're getting some of those incentives. With this and bringing it all into a consistent platform as well, you're not having to go out and get reporting from multiple areas. This is an area that really helps us make it strong for you to analyze your spend and find those opportunities for savings and consolidation. So we have a variety of reporting and analytics tools, as well as we are an applied technology company. That's one of the things I love about it, is really driving innovation. And we've been doing some incredible things with artificial intelligence, or you may hear me reference that as AI, to really start digging into that mass amount of data. I mean, with food, the products are changing on a daily basis. The pricing is changing on a daily basis. Your contracts are changing at different times. And so with all that coming into one system and some of the technology and AI that we have, that really helps us identify areas of opportunities that we really work with you as a corporate organization to figure out where we want to move next with you.
That's awesome. I got to imagine that food is probably one of the most complex categories. It's funny that we're talking about food, but it really is. You mentioned about some of the complexity, not only supply chain issues, but just the changing of contracts, and these things change in price very frequently. And so being able to lock those down is a big deal. You mentioned an interesting point in there about the suppliers. If you're on the supplier side, this is probably a big benefit as well, because you're getting paid faster because of that stuff that may get stuffed in a closet or in a drawer somewhere. So that's awesome. So we've talked about some of the benefits from a corporate standpoint. But from an end user standpoint, it's one thing when corporate has their own goals of what they got to do. But from an end user, how do you make it simple for the end user to be able to do what they need to do, and managing inventory and being able to purchase on system and make this automated, and so that it's not a headache that's being kind of like pushed down on the people? Can you talk through that a little bit?
Absolutely. So that's really part of the implementation process, and that's a great point, Tom. We take pride in making sure it's very friendly for the end user. So I touched on it a little bit in the previous screen. Less training from a corporate perspective because it's a consistent platform regardless of the vendor that you're using. But I like to share the number. Once in the case study that we're talking about here, once we implemented DSSI, we had 98% compliance to ordering using the DSSI platform. That really is incredible because it doesn't matter how much time you spend finding the right products, finding those cost savings. If they aren't using the system and they're working around those guardrails and controls that we're putting in place, you're not going to see those results. So it was really great that we had 98% compliance. We got a lot of feedback that it was very easy for them to use. They liked that regardless if they were going in from their primary or secondary vendor, they were able to have the same experience. They were able to keep it in the same lists. And we were able also to implement a few different things such as mobile ordering, par levels, shelves, and order history. So let me dig into each of those a little bit more. With our shelves functionality that we call it, we really allow the facility to set up their storage locations in a shelf to sheet order. And so they can put their products in to match their shelves, their freezers, and in the order that it's stacked. And a lot of them actually had access to tablets within their hospital system. So they would then walk through and take inventory of what they needed for that order. And because they could have multiple vendors on the system, they could intermix their vendors together. We had actually went in and done a time study. So before they had printed a shopping list from their primary vendor, a shopping list from their secondary, maybe from their produce and dairy vendor, and then would kind of go through and do inventory a few different ways depending on what products they knew they were purchasing. Here they can go just down the line. And we actually found that it saved them about 50% of their time in ordering. So now they could spend that time helping in other areas of the operation. Also, another feature that we have in the tool that is really helpful is budget control. So they can see a live spend down. We actually have ways that you can send a back feed through DSSI. So if there's some local vendors that maybe weren't quite being purchased on DSSI, that's all taken into account to give them an accurate budget of where they're at for the week or the month to really help them manage to that. And then we know that getting support for these end users is really important. So we actually have a dedicated support center and help desk that if they have a question on functionality, if they need a password reset, they can always access. And we have tons of help videos on tips and tricks of how to place an order. But usually it is so user friendly. They are able to figure it out on their own. And again, we've had great success rate. And in this particular case study, 98% compliance. And I would say a little over half, or about 70% of the system, was using the shelves or mobile ordering to really increase the speed of their orders as well.
That's awesome. I love some of the features you highlighted, the budget control to allow people to be able to see where they are in real time in relation to their budget, and the ordering functionality and the inventory functionality, and the fact that it's all mobile within the power of your hand is great. So Meagan, we've talked a little bit about this. We've reviewed some of the savings of this specific case study. We've talked about some of the functionality and the benefits to the corporate user as well as the end user. Can you walk us through some of the sausage making? Like give us some real details on this specific client of some of the opportunities that you found and how you went about implementing over $700,000 in savings.
Sure. And I love the sausage making analogy. I always love a good food pun. I can never get enough of them in my day to day. So want to talk about just a really basic example that we have here that I did around applesauce cups. And so there's a few different ways that we find savings, but with this particular system, I was really just going for some exact matches on it. So when we're looking at the process to standardize and really optimize on the products that you would be purchasing for your system, we take into account a few different things. So the first one, the menu ingredients. What absolutely do you need to be producing? In this example, we are really focused on the patient menu. Since this is patient care, what are the nutritional needs? So are there certain protein specifications we need in the chicken breast that we're looking at? What are the sodium requirements? What are the allergens? Just so we can limit exposure to what's going on in your care setting. Also, looking at it from a quality perspective, it doesn't matter how much you're saving, but if that product doesn't stand up for the food service operations, it's not going to work and it's not going to save you money either. And then also being mindful of pack sizes. So sometimes you can bring forward a lot of savings, but it's maybe using a 50-pound bag, but it's a small operations and they're going to be going through waste before we can use it. So we're really taking into account all of that. In some of these examples, like I said, we're going for just more like for like matches. Other times we may look at operational efficiencies or changes to get cost savings or improve the patient experience. And I'll spend time working with the system to really make sure it's going to meet the needs and also take into account labor. We understand labor is a challenge right now. So maybe there's something that we'll implement down the road, but not quite at this time. So in this particular example, we are looking at just 4-ounce apple sauces. They were buying 5 different products in the system. There was actually over $14,000 in savings just in this particular item, and took a look at it, looked at the contract, and really said, this is the item that the whole system should be using. There really shouldn't be an argument coming from anyone that they have to use a different applesauce cup in this example. They're all 4 ounces. We were just saying what's stocked and available. We also take that into account that I didn't mention. So what is the availability from your broadliner? So we're really putting forward savings that are real and actual. And we are able to get $14,000 in savings. So this is what you're seeing, really the back end work of some of our AI. We have culinary specialists who do a lot of categorization work to really help us find and present these opportunities. And in a lot of instances, we'll review it with the client if they're what I like to call the more emotional items. So maybe we're changing bacon or chicken breasts, or there's certain regional preferences. And so we'll really take that into account and then make recommendations. So you can see here, the recommendation would be to really block those additional items so that they're no longer purchasing it. So with that, let me show you how that shows up for the end user. So you can see again that on the screen here, I'm showing those additional applesauce cups, and we were actually able to put a message on, you can see here on the screen, that this product was blocked by the purchasing department. We can do some redirecting here. And then also the item that we chose is going to show that it is on rebate or contract for them. So we really get all the information coming in from the broadliners, from your GPOs, to really help make those best decisions, or have you help make those best decisions on what your hospital should be purchasing. And this becomes really helpful. There's constant things that are triggering why you maybe want to block products or purchase different items. Your contracts change on different intervals. Really this optimization process that I walked through here, where you want to bring that consistency. So regardless of what hospital a patient comes into within your system, they're going to get a consistent patient menu experience, from what's showing up on the menu to, as much as possible, what's actually being served for the products being purchased in your kitchens. We have a variety of order guide controls. In this particular example, the system wanted to allow for open order guides because we hadn't really touched anything or optimized anything in their cafes. But we were really focused on the patient menu, and that's where blocking becomes really helpful. So you can still allow them to purchase, a variety of products that they may need because the operations run different, but anything that really is used for the patient menu that we have identified have been purchased but shouldn't be anymore, we can go in and work on blocking to really help drive towards that consistency and those savings that we were working so hard to get to.
I appreciate you walking through the sausage making. I knew you'd appreciate a good food pun. It's either that or bacon, right? We always we gotta poke fun. So in walking through kind of this entire life cycle. When we bring on a spend management consultant like yourself, Meagan, to be able to work with the teams, we put together a very custom roadmap. With each customer, it's going to be a little bit different. You mentioned at this specific client that some of them were self-op, some of them weren't. They're on different patient menus. They were kind of all over the place. And so part of what we've done is just the beginning of the journey. There's a ton more that we can talk about. Can you walk us through kind of the rest of the journey and what we spec'd out for this client, just to give kind of the audience an understanding of everything that is encompassed in bringing this ecosystem together?
Yeah, absolutely. So in this example, as Tom mentioned, really the first area that we felt was really critical to get to was getting them on a standardized patient menu. That was one of their goals as an organization. And with that, we really wanted to standardize the products. So that's where we started out. They really got down from multiple menus to that one menu. We were taking a look at what their whole spend was, what was being purchased off order guide. Again, that's where we found those over 500 products were being used, and we were able to get it down to the 115. They were using multiple produce vendors, so we were able to get it from 4 to 1. It's really timely. Recently in the news, there was the onion recall. And so the fewer vendors you're working with, the fewer you're tracking down some of those recalls and food safety information as well. Also, one area I didn't touch on that helped with the standardization right now, the supply chain challenges. Really, the more consistent you're buying those same items, the better that those distributors can support you and less chance of out of stock. So that's really where we zeroed in to make sure that we had a good, stable supply chain for that patient menu as our first target. Then, we get to tightening down some of those controls in that area. So we wanted to block those non-compliant patient menu items. And once we get that under control, what we had really looked at, and here's some examples where we would look at other systems, is how can we then carry that over into your cafe menus? What can we do to get consistent recipes in any of the menu systems that you're using? So they may not all run the exact cafeteria, but they should all be pulling from a consistent bank of recipes and then going through that same process of creating a standard order guide of products that they could produce any of those recipes off of, instead of just letting them have full reign of that vendor catalog. Because now you're going to get, again, the best, most consistent product. You're going to get better support from your supply chain partners because there's consistency in the ordering, and you're going to be driving to those contracts. If some of them are volume-based, incentive-based, you may have drop size discounts, so you're going to drive as much to your primary vendor. So once you can start pulling in the cafe and catering and all of that, you're going to just continue to push forward on those rebates and allowances. And then we have a variety of reporting to help monitor their compliance. Are they purchasing on the order guide? Are they purchasing from the correct vendors? Where can we find the compliance or better compliance with your contract programs? And then as we get them adopting that, how do we continue to tighten those controls? And the beautiful thing is you can do it by hospital. So you may have some hospitals in the system that are just rock stars and they're hitting their budgets and they follow the plan. And wouldn't we all wish every single one of them were like that? But again, I think in every operation, just like the ones who shove it in a drawer, I find those operations that you just don't have as strong a labor or the compliance. And so we can turn on tighter or more flexible controls really at that level, depending on how they're performing as well. And as Tom had mentioned just in one of those first slides, this really is a cyclical process because of contract changing, products changing, pricing changing. It's something that we continue to just work with you and evaluate and adjust to really have success in your dining and nutrition programs.
For sure, that theme of analyzing, optimizing, and controlling your spend holds true here. Well, Meagan, thank you so much for your time. We really appreciate it. You're definitely an expert in this space. It's always good to have a registered dietitian representing this space. As we mentioned, every hospital is going to be different and unique. And the beauty of this is that it brings all parts of the ecosystem together. I think Meagan did a very good job of discussing the benefits to all parties. We're excited to talk through with you. If you have any questions, please fill out the form so that we can have a personalized discussion. Every situation is different and the goals are unique for every specific provider. We're passionate about this. We'd love to talk to you. Please fill out the form. And until next time, we'll see you on a future webinar. We'll see you.